Good afternoon. I'm Kristen Fluitt, Program Manager at the Ohio Chapter American Academy of Pediatrics. On behalf of the Ohio AAP and the Ohio Department of Health, thank you all for joining us for today's webinar, Making the Most of Adolescent Well Visits. We'd like to offer a thank you to our sponsor, the Ohio Department of Pediatrics, for supporting this work on improving adolescent health care. Before we begin, I'd like to draw your attention to some important webinar logistics. Today's webinar is being recorded and you are currently in a listen-only mode. Use the question box in the webinar to submit any questions throughout the session. We will designate time at the end of the webinar to answer as many of your questions as time allows. A link to the audio recording of the entire webinar will be sent via email in the next week. During the webinar, toward the end, 10 multiple-choice questions will be presented. We will use polling software to record your responses. Please be sure to answer all the questions, as this will serve as your quiz for MOC2 credit. If you've never used polling before, don't worry. It's really easy, and we will walk you through it when we get to the questions. Now I'd like to welcome our two presenters today, Dr. Michelle Dritz and Dr. Sarah Adams. Dr. Dritz completed her undergraduate degree at the University of California, San Diego, her medical degree at Albany Medical College in upstate New York, and her pediatric training at St. Louis Children's Hospital, Washington University in Missouri. She then went on to complete her adolescent medicine fellowship training at Cincinnati Children's Hospital Medical Center, along with additional training in healthcare quality improvement. After her fellowship, she practiced for 5 years as a civilian provider at Wright-Patterson Air Force Base in their adolescent medicine clinic before joining Cornerstone Pediatrics. In addition to her clinical work, she works closely with the Ohio chapter of the American Academy of Pediatrics as a medical director and consultant for some of the adolescent healthcare quality improvement programs in Ohio, is a member of the Ohio AAP's Committee on Adolescents, a founding member of the Ohio Adolescent Health Partnership, and is an advisor to the Ohio Department of Health as part of their statewide work on improving adolescent health and well-being. Locally, she is a faculty member at the Wright State University School of Medicine, which allows her to work closely with medical students and pediatric residents. Dr. Dritz and her husband have 2 children. Also joining us today as a presenter is Dr. Sarah Adams. Dr. Adams is a pediatrician with Akron Children's Hospital in Hudson, Ohio. She received her Bachelor of Science degree at the University of Akron and graduated from the University of Cincinnati College of Medicine. Working as a pediatrician for over 22 years, she enjoys incorporating her real-life experiences as a mother into her pediatric practice. In addition to her passion to care for children, she loves to teach medical students and residents and is an associate professor at NeoMed and Ohio University Heritage College of Osteopathic Medicine, as well as a resident preceptor for Akron Children's Hospital Community Outreach. Promoting healthy lifestyles mentally and physically in children and adolescents has led her to speak for surrounding communities and at the annual Ohio AAP meeting. She is passionate about improving the way families use media, bullying prevention, and adolescent medicine. Dr. Sarah Adams resides in Hudson, Ohio, with her husband, John, and 2 boys, Gabriel and Benjamin, as well as her 2 labs, Buck and Gus. So I will hand it over now to Dr. Dritz.
Thanks, Kristen. Also, just one other reminder, and we'll remind everyone when we get to the quiz portion at the end, because, again, the doing the questions at the end really are about doing the things that we need to make sure that you guys get your MOC2 credit for this. So if you happen to be logged into the webinar as a group, so maybe just one person is logged in, but you have other providers there as well who are looking for the credit portion of the webinar, then we'll have you guys just send a quick email response back to Kristen with the answers for your quiz, since unfortunately it's only going to recognize whoever's logged in terms of their answers for the quiz and the MOC2 credit. So with that, though, let's move on with the heart of what we're going to talk about today, and that is adolescent well care visits in particular, but preventive care in general, and really how to maximize that both for our patients that we see in the clinics every day and to make that as efficient and effective as a process for us as clinicians as well. And I like to just start off reminding us all that there is just a lot of stuff going on during these adolescent years. This is a quote from the Ohio Adolescent Health Partnership Strategic Plan from quite a few years ago. But it just reminds us that fairly similar to infancy, adolescence is a close second in terms of just the rapidity of changes, physical, developmental, pubertal, emotional, psychosocial, that happen. So there's a lot that goes on during these years, but these also tend to be the years that we see families and teens the least, because they're not necessarily thinking in the same mind frame they are in terms of ongoing and regular care, even preventive care with pediatricians. So we want to help change that framework for families, help remind them about the importance of that ongoing preventive care, and help us as providers really feel comfortable meeting the needs of those families and adolescents. And many of you may feel this way sometimes. I know that I oftentimes did, especially early on, when we see a teen patient showing up on our schedule, whether it be for a well visit or something else, we oftentimes quickly feel overwhelmed by everything that must be going on in their lives and brains and so forth, and it feels almost too daunting occasionally as we think about caring for adolescents versus many of us feel extremely comfortable caring for all the significant developmental changes that are happening really regularly in all of our younger patients, infants, and as well as younger kids. And I think that's the part to remember, that as pediatricians, part of what we excel at, and as family practitioners, part of what we excel at is that recognition of development over time during those childhood years, including those adolescent years. And that development follows a particular trajectory that is related to what's going on in terms of brain development, physical development, otherwise. And if we remind ourselves about the roots of our experience and training, I think it helps us gather that confidence that we need to remember that we can do this for teens as well. Sometimes it takes a little bit reminder about what are those important aspects of adolescent care that I need to be thinking about, in the same way that is sort of a knee-jerk reaction when I think about the care for a younger child. But we have those tools as clinicians as part of our training, and we really can play a significant role in how well our teens and their families can move through this really large transition period in their life as they move from adolescence to young adulthood. And it's really important because right now, nationally as well as in the state of Ohio, we're not doing great when it comes to adolescent well care. These numbers that you're looking at here are national data, though the Ohio data is very similar. Only about 48% of adolescents have had that once-a-year preventive care visit that is currently recommended by the AAP as well as many other national organizations. And of those, only a fraction, a little over a third, are actually receiving all the recommended preventive services that we know are important as part of those visits. Immunizations, time alone with their provider, certain screening labs or screening processes that are recommended. So there's a lot of room for improvement for all of us as providers to really maximize and enhance the care we're giving our adolescent patients. Part of the challenge is that we're just simply not seeing these teens in our clinic very often. I think that has a lot to do with just the sort of societal framework in which many families aren't in that same sort of mind frame of regular routine follow-ups with their medical providers or their medical homes the way it was so embedded with them when they were in those infancy and toddler years. And so the more we can educate ourselves, the more we can educate our families about how important still at least once a year annual well visits are and all the preventive care services that go hand in hand with those, in addition to obviously any acute or chronic care needs that those patients have, the better chance we have to really meet these adolescent well visit and preventive care standards that we know are important. Right now, on average, again, this is national data, but we see teens in our clinic less than, oftentimes once, maybe less than once a year. And most of the time, those are for appointments that are scheduled as acute or some sort of chronic care follow-up appointment. We're not necessarily seeing families as much in for what is at least recognized ahead of time as them being due for an annual well visit. So we want to help change that dynamic as part of our bigger goal of improving adolescent care. The other really important aspect of adolescent care that is unique compared to the care that we are really comfortable and used to doing with our younger patients is that importance of confidential time during all visits, but certainly during the well visit. And for those of you that were able to be part of the first webinar that we did 2 months ago, and if you haven't and you're interested, you can access that online at the Ohio AAP's website. But, you know, there's a lot of research and evidence that tells us why having one-on-one time with a teen during the visit is so important in the type of screening that we can do as providers and in the type of conversations that teens feel comfortable talking with us about, and their decision to access care, not just care that would kind of be put into the category of confidentiality potentially like STD screening or birth control, but any care if they're not feeling that they have the option and the ability to access confidential care when they do need it. So building that in as part of your routine practice with adolescents and families so they understand how that's a developmentally appropriate, important component of well care and visits in general as these teens are learning to build those skills that are important in health ownership as they eventually get to the point where we are helping them transition to adult care and into the adult world. That one-on-one time is really paramount. In addition to that, though, I think many of us already recognize just how much is part of a well-done, comprehensive well visit, whether we're talking about adolescents or younger kids. Not much more than what you would already anticipate. Again, immunizations, health screening, review of history and exam and so forth, including sports participation so that even if they're not in for a sports physical that day, we're doing all the things that help make sure they're as safe as possible for sports participation in that upcoming year. But again, that confidential one-on-one time is really paramount for proper screening during these adolescent years for certain risk behaviors and just building those skills of health ownership that we're all trying to help our adolescents reach. So with that, I'm going to pass it on to Dr. Adams, who's going to talk a little bit more about some of the strategies for making these well visits efficient and effective in the primary care setting.
Thank you, Dr. Dritz, and thank you to the Ohio AAP for letting me participate in this webinar. I'm very excited, and I don't know about you, but if you're a primary caretaker like I am, primary provider, there was a time when I would look at my schedule and I would see adolescents on my schedule, and it would make me very nervous. But I think that there definitely are strategies that we can use that will make you more comfortable and get through the visits, because we all know we only have an infinite amount of time to be able to get through everything that we think is important and effective for our teams. And I put this slide in because I really believe that adolescence is that last time where we're going to be able to make a difference in their human development. And I hate to say it's like a last-ditch effort, but there's so much that we can do for them that will impact them as adults and really for the rest of their life. So what I decided to do is talk about what we do in our practice that has been very effective and help us get through, because most of the time our well visits for adolescents are only given 20 minutes. which is really tough to do. So I had to figure out, okay, what do I need to do to make this very efficient as well as effective? So planning ahead. It's amazing how just by taking a few minutes before you go in, before you start your day, before you walk in the door for that office visit can make a big difference. So in the morning, I huddle with our team and then ultimately the medical assistant, and we look at the schedule and we see, okay, who are the adolescents that are coming in for their well visits, and then who are the adolescents on my schedule that are coming in maybe for a different reason, who are due for preventative care. And then we also look at, okay, let's talk about, are there any pertinent medical issues that we need to address and think about before they even come to the office. Some of these things can be having sports physical forms available. I can't tell you how many times parents have come into the office, they're there for a sports physical, they don't have the form themselves. Having that readily available, knowing that having your MA have it in the hand when she's rooming the patient and say, do you need a sports participation physical? Because I like to have them complete all of the questionnaire that they are to complete before I even do my exam and sign the paper. And what I'm talking about is that medical and family history questionnaire before I do my physical exam components. We anticipate screening needs. So in our office, we give every teen from 12 to up through 21 a PHQ-9 form for depression, and then an asthma control test if they have a diagnosis of asthma. And again, we have that ready so that they can do that while they're waiting for me before I come into the room. The MA then will document chief complaint, any issues briefly, make sure they get their vital signs, as well as making sure the growth chart is complete. Now I get the chart. And so once I get the chart, I look over all those things, components, including the problem list, which we like to keep up to date. I think that's very important. And if you're not sure it's up to date, make sure that's part of your history taking. I make sure review the medications, allergies, and history. And then I also review previous encounters. When was their last well visit? Have they seen a specialist recently? Have they been in the office for acute care visits, emergency room, or even urgent care? And then I will look over their health maintenance, which gives me an idea of what immunizations are available. So before I've even walked in the door, I know what their needs are. I have an idea of what their past has been, and I'm ready to go. One of the things that I find has been very effective is using screening tools. And I find it helpful because while they're waiting for me to come into the room, they have an opportunity to fill out these forms, and then it's easy for me to look over them when I come into the room. And I listed some of my favorites, and then I also listed a couple screening tools that will be helpful in regards to history taking. So the AAP Bright Futures Supplemental Questionnaire is readily available. It's extensive. I mean, it basically asks questions about nutrition, physical activity, safety, emotional health, substance use, and sex. So it pretty much covers many of the key components that we want to cover in our well child adolescent visit. It does come in two parts. So there's one that the parent can fill out, and there's also one that the student or the adolescent can fill out. We also have, I'm going to jump down to the PHQ-2 and PHQ-9, which I mentioned before, which is for depression and psychosocial screening. And the PHQ-2 is basically just the first two questions of the PHQ-9. So it asks questions about anhedonia, basically things like, do you have little interest in activities, and number two, are you feeling down and depressed? I personally like using the whole PHQ, the 9 instead, which asks all of the questions, because there's so many other components that can come up in regards to their psychosocial as well as mental health that I think that just screening for those two things, you could miss a lot of concerns, especially when in regards to safety and suicidality. But if you are really pressed for time, you could start with the PHQ-2 and then decide, okay, we need to do further screening. The CRAFT and the SBIRT, I like those as a tool when I'm doing my history taking. So basically, this is used to ask quickly about substance use and abuse. The CRAFT is very similar to the kind of the PHQ-2 in that you really only have to, in this case, start with a couple questions and then decide, do you need to continue? So the first two questions you want to ask before you continue is, number one, have you ever tried alcohol? Have you ever tried marijuana or any other substances? And there's, of course, different ways that you can phrase that question, but that's what you're trying to find out. And then if they have, then you start to proceed with the next questions, or if you're getting an idea that they could be at risk. And so the C stands for car, and so you talk about, have you ever gotten into a car where someone who's been drinking or high or on drugs is driving. The R is, do you ever use substances to relax? The A is, are you alone? Do you ever drink alone, for example? F is, have you ever forgotten events after you had been drinking or using substances? The second F is, friends or family ever told you that they were concerned about your substance use? And then T stands for trouble. And really memorizing that, it just took me a few seconds, to really ask those questions. And then if you need to get into it a little bit more in depth. Now, the SBIRT stands for screening, brief intervention, and referral to treatment. And again, these are all just tools that we can use to be very efficient and effective to look for those substance use behaviors, to have a short conversation about substance use, get feedback from them, and provide advice, and then if needed, refer for treatment. Now, there are other screening tools that I found through my research that I noted under miscellaneous. The SCARED is a screening for child anxiety and related disorders. The YPSC is through Bright Futures, and it's a youth pediatric symptom checklist. FISTSS is screening for violence, and the SCOFF is a screening tool for eating disorders. So those are additional tools that you can use if necessary. Okay, so you've done your preparation. You've got your screening tools. Now you're ready to walk in. You're going to take a comprehensive history, their medical as well as mental health. I usually start with the adolescent and the parent collaboratively in the room. I really try very hard to speak to the adolescent primarily and the parent secondarily, because I think it's, I try to engage any child at any age when I'm doing their physical and well visit exams. And then I ask the parent to leave, and I have some one-on-one confidential time with the child. And ultimately, I think in best case scenario, it's nice to also have some time with just the parent alone too, to talk to them in confidentiality. Now, getting through that history. So, heads, again, I'm throwing out, I feel like I'm LMNOP, like all these different letters and ways, to remember things. But I really do think it helps. So home, eating, education, activity, drugs, drinking, sex, sexuality, suicidality, and mental health and safety. See, the 5 key components that we really want to stress when we're doing our WellCare visit is mental and behavioral health, tobacco and substance use, violence and injury prevention, sexual behavior and nutritional health. And that heads assessment is such an easy and quick way. And if you know it in your head, you literally can go boom, 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 boom as you're asking questions. Now, sometimes you're going to get stuck on one particular letter, such as education, or maybe you're going to need to spend more time talking about sex and their sexuality. But that's what's nice about using the HEEDS as a tool for taking history, because you can go quickly through things that are going well and then use the time that you need in the areas that need greater attention. So just to reiterate what Dr. Dritz also said on her slide is, again, you want to just focus on what do we need to do to get our comprehensive exam, the medical family history, sports participation evaluation, physical exam head to toe, the confidential psychosocial assessment, which, like I said, using your screening tools are very important, preventative health screening such as vision, hearing, dental, and lab work if it's appropriate, immunizations, and then making sure that you have a planned follow-up if necessary. And then document. Make sure if you're going to use those assessment tools, make sure you document that. I want to mention something that we do through Akron Children's Pediatrics as a way to compensate physicians for trying some of these different tools and incorporating them into their practice. Last year, we had a quality assurance measure that was the PHQ-9. So we would give the patient the PHQ-9, we'd fill it out, we'd document it in our chart, we billed for it, and because we would bill for it, we had to also do like a procedure note, which was extremely easy, just basically putting in the score and then what, if you plan to follow up and kind of measuring what risk they're at based on their score. And what our administrators were able to do was, because of that documentation, they were able to see the percentage of adolescents between age 12 and 21 during their well visit that were getting the PHQ-9. And then if we met our goals, we obtained a bonus at the end of the year. And I have to tell you, that was a big incentive. And, one of our strategies is that we want to incentivize providers to use these types of things. And I would say that it definitely worked for our group. And now, not only did I get a bonus, but I was also able to get MOC credit, which was amazing. And now I do it very routinely. It's become second nature to us. Another screening tool we're planning to do this year is we're going to be doing the asthma control tests, and they're going to be also following our immunization bundles with our adolescents, such as the 11 to 12-year visit and the Tdap, meningitis, and HPV vaccine. So if we meet the goals that we've set for our practice at the end of the year, there'll also be a bonus for us then. So I think it's something to think about in your practices. The thing is that these are not new ideas. I'm not telling you anything that you don't already know. I think what it is just being able to use some of those different acronyms and knowing how to do it and practicing it will really help you make sure you're efficient but also effective. The goal is that we obviously want we want to reinforce these healthy promotion messages. And when we have them in our practice, no matter what they're coming in to see, we want to make sure that we're, reinforcing their growth, their development, supporting their psychosocial and emotional needs and well-being, encouraging healthy lifestyles, but also giving them the confidence that they can do what we're, recommending that they do. And I think that can be really exciting when you get an adolescent who's really ready to make a difference. So in 1967, Congress introduced this Medicaid benefit called EPSTD, which stands for Early Assessing and Identifying Problems, Periodic checking children's health at periodic age-appropriate intervals, screening, the physical, mental, development, dental, hearing, vision, and screening tests to detect potential problems, diagnostic, as well as treatment. And these are screening services that, as I mentioned, are very comprehensive, and it includes the physical exam, as mentioned, the immunizations, the lab tests if appropriate, and the immunizations. And I think a lot of times families don't know that these services are available to them, and so letting our families know that we have this and that resources are available and that they're not alone and that we are there, for them to help guide them through these state program guidelines. And so we want to make sure that we are informing all our Medicaid eligible individuals, and we want to make sure that we're providing provisions for their screening and arrange, if needed, corrective treatment and referrals, as well as being able to keep track of your support and follow through with these state guidelines. So I am going to hand it back to Dr. Dritz, and I hope that was helpful, and I look forward to hearing what Dr. Dritz has to say about doing all this work and then being able to get reimbursed for it.
Great, thanks, Sarah. So I'm going to take it in a slightly different angle. I'm going to talk a little bit more about the sort of documentation and reimbursement processes that are available to make it more efficient for you as providers. I'm also going to talk a little bit about some of the best practices that we know work well in helping do the very first step of that, and that is get teens and their families in the door for these well visits, which I know is often one of the biggest struggles that many of us as clinicians have for the reasons that we've mentioned already. So again, just increasing that well visit, it really needs to happen from multiple levels at multiple different angles. So ways in which we can integrate reminder systems and processes help. Whenever we as clinicians, as Sarah alluded to when she was doing her team huddles, are able to sort of recognize when someone is due for certain things, plan for it, build it into what we're doing, or at the very least, build it into how we're setting up their follow-up care, scheduling for their well visit if that's what they're due for, those sorts of things, the better chances we have of meeting their preventive care needs and our needs as providers in terms of meeting those. And then really, again, the bigger concept here is just trying to make the most of every opportunity. Some of the reminder system processes that has shown to work really well, whether we're talking about, frankly, adolescent well visits or other type of medical care, you can kind of categorize into three main areas. Those that are more in the proactive category before they're at your door, where you as the medical home are anticipating that need. And many of us, as we've moved to EMRs or have access to population health software, or our institutions have people who are involved in population health, we can nowadays more readily access some of this information in terms of who is the list of people who are due or overdue for immunizations, well visits, other preventive care that give us a really targeted audience of who we should be sending our reminder calls to, or reminder letters or texts, or whatever system that your particular clinic or institution has used and found effective. And there are a variety of ways that many of you may have found that that works. Another proactive step that some clinics do, especially when it comes to adolescents, is sending almost a welcome to adolescence letter. And we do this in our clinic, but we're not certainly the only example, where we really target those adolescents. You can sort of make your own decision. 11, 12, 13 years of age is a typical timing. But sending a letter at that age for patients that are already part of your practice saying, welcome to kind of a new way of caring. It's a great time to remind families how important regular yearly preventive care still is, even if they've gotten out of the habit of them during those younger school age years. And two, it helps both for teens and their families start to recognize and hear before it happens how things may look and feel a little bit different during those visits that they see. That we're building towards that one-on-one time with each patient, with each teen during those visits, that we're trying to help build those skills of health ownership, that there are confidentiality options available in terms of teens being able to seek out certain care for certain services on their own, and what that policy is so that the teen knows that and the mom and dad knows that and the guardians know that, and so they also know what the limits of that confidentiality is. So that welcome to adolescent letter can be a really useful messaging from multiple angles for both the teen and providers. And, I have pictures, I think they're showing up here, of the dentist and the vets, but I think they are two examples of the medical world that they do a really fabulous job of this very proactive reminder preventive care services. Scheduling next month's or the next year's visit before they're leaving the door at that visit is just one of the examples of how they do this really well. From a reminder system standpoint, though, there's also those opportunities of recognizing when someone is overdue or coming due for certain preventive services at the moment we are on the phone with them or seeing them in the clinic, and that, as Sarah was mentioning, can really be enhanced by things like team huddles. It can also really be enhanced by processes that your front staff and your nurses can be a part of. When a family is calling for a medicine refill or a family is calling for a form to be filled out or an acute visit for something other than a preventive care service, that is an opportunity for the front staff or nurse to see when their last well visit is, to help accommodate whatever needs to be accommodated, but also hand in hand get them scheduled for that well visit or get them scheduled for whatever it is that they're due for. And then after the fact, many of us already may have services like this where, if someone misses an appointment, calling and seeing what we can do to help get them rescheduled. That's also true of if they're overdue for their well visits or missed a well visit appointment. Again, having some process in place for your clinic system that allows you to really follow up with families so that you can help address any barriers that may be going on that's leading to them being overdue, and also help them get caught up. That, again, just really emphasizes this really useful strategy of coupling and capitalizing on those common needs, needs that the family and the teens have, as well as needs that we have as clinicians, needs to some extent that are put on us by our insurers in terms of meeting certain healthcare standards. These all have the common goal of providing preventive care to our teens. If we're doing that, we're doing a good job for our teens. We're also doing a good job for ourselves. So being mindful, and more than being just mindful, really strategizing in your clinic to determine what are the best types of processes, where's the places where you can standardize an opportunity for not just you as the provider, but your entire clinic staff to create systems that allow you to very quickly and very in a standard way be thinking about and cognizant of and looking at things like preventive care and whether they're overdue at any moment in time that there's a contact point with a teen or their family, especially knowing that those contact times may be few and far between. So we want to maximize them whenever we're on the phone with them or seeing them. And then the other piece that's more specific to this adolescent population versus maybe some of our younger patients is, capitalizing on what's unique about teens themselves. Part of that is that important piece of confidential care within your clinic, helping teens and families know that that's part of good, healthy, developmentally appropriate practice for adolescent care in any clinic setting, but also helping teens and family to understand what that confidentiality means, what it doesn't mean, therefore what the limits are in terms of safety for those teens and adolescents, and putting that confidentiality practice or confidentiality policy into practice. It also is a great opportunity to really harness the powers of technologies, knowing that teens often are some of those that are in the forefront, so they may be a particularly useful population to target some of our reminder strategies that are social media or text-based or technology-based. Those teen patients may be particularly useful for those particular types of reminder systems. And again, remember, part of that sort of developmental component of what we as providers are trying to help our teens and their families meet during these years of adolescent care is helping them develop those skills of health ownership. So having those ongoing conversations with families and teens about how to do those confidential or those health ownership skills, practicing them, as Sarah was kind of mentioning, focusing the conversation towards the teen with mom or dad or the guardian being sort of the ancillary but important extra piece there. Those are small little ways that we're putting into practice and teaching teens themselves and their families how we're going to try to help shift that skill development so that the teen really gets to practice those in a way that hopefully by the end of those adolescent years they really have a good handle on them and are ready to transition into the adult world. And as Sarah's mentioned already to a large extent, so I'm not going to focus too much on, but we really want to make sure that as we're making them of every opportunity, we're integrating those preventive care needs into any visit if we need to. Well visits that are specifically listed as a well visit are great opportunities to do that, but sometimes you may not be that lucky. So even if it's an acute visit, can you build in some time for that confidential one-on-one time for at least some degree of screening? Can you build in at least PHQ-9 or some sort of component of depression screening into every visit, so at the very least you're becoming aware of any critical issues that you may not otherwise be recognizing because they're not getting in for well visits. And thinking outside of the scheduling and billing box seems to be a really useful strategy for meeting the needs of adolescent cares in particular. I think as we all inherently recognize, taking care of teens and just simply the way an adolescent visit looks compared to a visit of a 2-year-old or a 5-year-old or a 7-year-old looks very different, and in large part what looks very different about it is the time that it really does take to do the things that we know are really, really important to do, including, and probably the biggest piece of that, being that confidential time that allows really useful screening to be happening. So in some cases, clinics are creating basically adolescent champions where a provider or two may be taking the bulk of patients that are the adolescent patients onto their template and have a template that may look a little bit different than others, but also recognizing that those type of teen visits may be eligible for different type of billing coding and reimbursement as well that helps balance that differential between those quicker, younger patient visits and those longer counseling intensive visits that tend to be the teen type of visits. So using things like time-based billing for those where the counseling is taking up 50% or more of the visit, using potentially modifier 25s when you're able to do a type of visit that's both the well visit plus some acute care or chronic care follow-up visit where you're maximizing both your time and the patient's time and the reimbursement that goes along with it. And then don't be afraid to learn and copy and steal from others because, as we all as clinicians try to figure out what works best in our clinic, we can become each other's helpers in terms of passing those really successful strategies along. And if not, being able to integrate those successful strategies as is into your clinic, they may be a great jumping off point in terms of you being able to tweak strategies in a way that does fit a little bit better with your clinic and really maximizes our ability to care for our adolescent patients. In addition, at a completely kind of separate level, we're, I think, particularly here in Ohio at the moment and nationally, at a point where there's a lot of focus on adolescent care from the insurer and payer and just national standards standpoint. So many of you, I'm sure, are aware of our national HEEADDSSS metrics that really are used in part as goalposts for insurers to help say, are we meeting care of our patients the way that at the level we should and at the way that we know we want to, and using those to some extent to be comparison points between one insurer versus the other, one provider versus the other, and so forth. And because those HEEADDSSS metrics, whether we like it or not, play such a big role sometimes in an insurer's bottom line, they have begun to translate to opportunities for us as providers as well, because many insurers are stepping up and doing some enhanced reimbursement or pay for performance when clinics and providers are really improving on those care points. So particularly for adolescent health, the adolescent well visit itself, the immunizations and some of the screening, including depression and chlamydia screening, counseling on diet and exercise, those all have their own HEEADDSSS metric or all have their sort of national standard that many of the insurers are focusing on. And the well visit obviously is a really nice sort of common point where all of those or many of those features often get discussed. So if we can do a really good job of getting patients in the door for their well visit and doing a really great job of doing what we know is important during the well visit, we're naturally often improving on all of these measures simultaneously. And this is just an example from one practice here in Ohio, but you can see by really maximizing these pay for performance and reimbursement, enhanced reimbursement strategies, this particular group is able really to improve on the reimbursement up to close to $10 to up to $40, sometimes $1,000 a year per provider based on the improvements that they've been able to make in these measures. And, the flip side is it's doing exactly what we want, and that is improving the care that we're giving to our teen patients and their families. Whatever we do, though, we have to be thinking about its sustainability. In the long term, it's that sort of continuity and continuing of these types of practices that help teens over time and help families over time. And so we need to be keeping an eye on, is the process that we are trying to look at and leverage within our clinic one that we know that we'll not only be able to do now and do consistently now, but is it a process that we're going to be able to be doing consistently a year from now, 3 years from now, whatever the case may be, if, again, we're talking about a practice that we know is important to be integrating into the care that we're doing, in this case for our adolescent patients. So knowing that we're getting reimbursed for the care that we're giving obviously helps with sustainability. It's hard to make anything sustainable if you're losing money on it all the time. So again, we've talked about some of those documentation strategies including just remembering that some of those screening tools that Dr. Adams was referring to themselves can be and really should be coded, not only so that insurers recognize that you're meeting those standards, but because they also often have a small amount of reimbursement related with them as well. Helping, as Dr. Adams made a really good point of, a big part of being able to do well by teen patients is for us as clinicians to feel comfortable that we can do well by these adolescent patients. And that, for many of us, as we know, really just means educating ourselves and putting that education into practice until it really feels comfortable. The more we do that, the more we're going to be able to improve the care we're giving our adolescents. And embedding, again, thinking about those preventive care services just the way we do for younger kids, but for teens as well, beyond of a well visit. So if we don't happen to be seeing them for a well visit, is there components of preventive care that we can at least try to tackle today? Are they due for an immunization that we can get them set up for? Can we at least get them scheduled for their well visit while we also take care of whatever their acute visit is today? So with that, I'm going to hand it over to Dr. Adams one more time. We're going to go over the 10 MOC2 questions that we'll have each of you answer while we're doing them. And if, like I said, you're sitting around a computer with a group of providers, obviously only one of you are going to be answering in the chat box. So what the other people who aren't officially logged in will just have you guys jot on a piece of paper or something the answers to these 10 questions as we go through them, and then just quickly send an email back to Kristen Flewitt, who sent you this webinar reminder to begin with, and she'll be able to officially record your answers so we can get you all MOC2 credit. So with that, I'm going to hand it over one more time to Dr. Adams.
Okay, thank you. All right, here we go. Question 1. Pre-visit planning includes A, huddle with care team, B, chart review to identify previous conditions, last well visit, previous medical care, vitals, labs, images, specialty care, and prior health maintenance, C, anticipating screening needs, D, all of the above. So go ahead and there's the answers again. And all of you said all of the above. Wow, you guys are quick. There you go. All of the above are pre-visit planning. Question 2, a strategy to increase, wait a minute. There we go. I think I'm going too quick. Question 2, a strategy to increase the rate of adolescent well visits and preventative care includes A, encourage providers to offer well care and preventative services during acute or chronic care appointments when possible. Make adolescents feel uncomfortable when they're in the office. C, limit preventative services only to adolescents with insurance. D, separate preventative care from sports physicals. And go ahead and put your answer in. Give you guys a few minutes. And I think everyone knows that obviously we don't want to make them uncomfortable. We don't want to limit preventative care and, of course, to only those with commercial insurance, and take the opportunity to use the sports physical exam to do a complete well visit. And there's your answer. Question 3 is, which of the following are part of adolescent well visits and preventative care services? A, comprehensive health and developmental history, comprehensive physical exam, confidential time during the visit, appropriate immunizations and screening labs, developmentally appropriate anticipatory guidance, or F, all of the above. So make sure that you're putting your answer when you are putting into the poll. And everybody's doing a great job, obviously, all of the above. Next, and there we go. Strategies to improve adolescent well visit and or preventative care reimbursement includes appropriate billing mechanisms that allow for preventative care services on the same day as acute or chronic care visits, i.e. Modifier 25. B, strategic use of pay-for-performance measures that are utilized by both public and private insurers and aid in improving quality of adolescent care. C, use of time-based billing at non-well visits when addressing medical and or psychosocial issues that involve significant time spent counseling, greater than 50%. Documenting the appropriate CPT code for health screening done at the visit. E, all of the above. So go ahead and enter your responses. And everybody's doing wonderful. Again, all of the above. And again, all of those are strategies to improve the adolescent well and preventative care reimbursement. True or false? Educating teens, families, and converting sports physicals to comprehensive well visits is an effective strategy to optimize preventative care services for adolescents. True or false? And of course, we know that to be true. Question 6, true or false? Providing clinicians with resources about recommended adolescent preventative care services, risk assessment screening strategies, and local resources for support can help improve the quality of adolescent